Good morning, good afternoon, and good evening to our audiences around the world. My name is Bonnie McClafferty. I'm the Director of Food Safety and the Chief of Party for Eat Safe at the Global Alliance for Improved Nutrition. Eat Safe's delighted to be hosting this first event in a series of webinars that addresses the intersection of food safety and nutrition. At GAIN, our goal is to improve the consumption of safe, nutritious foods for all people, especially the most vulnerable. And we believe if food is unsafe, it cannot be nutritious. And we take this very seriously with our programming and research. If we care about nutrition, we have to care about the safety of the foods we advocate for. So GAIN is proud to host Eat Safe, Evidence and Action Towards Safe, Nutritious Foods, a USAID-funded 5-year project aimed at enabling lasting improvement in the safety of nutritious foods in informal markets by focusing on the consumer. So the emphasis here is informal and focusing on the consumer. So why informal markets? At GAIN, Eat Safe is keenly mindful that the most nutritious foods are also the most susceptible to transmit foodborne illness. We also recognize that many of the nutritionally vulnerable are sourcing their foods from these informal markets, and they are sadly highly susceptible to succumb to foodborne illness and disease. Why consumers? In these markets, the absence of formal infrastructure, regulation, and food safety oversight means the transactional relationship between vendors and consumers may be a sustainable opportunity to shape the market to be more safe. Eat Safe is gathering evidence, testing methods, developing tools for researchers and donors and governments to work with consumer groups and vendors as transformative agents of change for food safety in these markets. We are excited to collaborate in this effort with our partners, the International Livestock Research Institute and Pierce Mills Entertainment and Education, and of course, many of you who have joined us today. We are grateful to USAID in DC and at missions who are actively engaged in exploring this link between food safety and nutrition. You are about to meet a panel of distinguished food safety specialists. Our moderator, Lynette Neufeld, is the Director of Knowledge and Leadership at GAIN and a globally prominent nutritionist. She will introduce our panelists and guide us through this first opportunity to explore the linkage between food safety and nutrition. We invite you to engage in the discussion through the chat box. We will be directing video and audio access to allow free reign for your cats and your kids and whoever else is parading behind you in this challenging time of co-working through webinars. We are mostly appreciating you joining this webinar and look forward to seeing many of you throughout the series. But until then, please stay safe wherever you are and eat safe. Lynette, over to you.
Thanks, Bonnie. Welcome, everyone. I'm seeing already a lot of chats happening here and people from many, many parts of the world. It's exciting, the flexibility and options that our virtual world is creating for participation from around the world. So that's very exciting. So welcome on behalf of GAIN. We're very excited to be expanding our work on food safety at GAIN. We've been working on nutrition for a long time, and it is high time we build and embed food safety more explicitly within that work. We're very grateful for USAID in enabling us to do that through the Eat Safe program, which is now up and running. I don't want to take time away from our distinguished panelists, so I'm going to go straight into the introduction to our speaker. We will have an initial presentation followed by a panel discussion. I will introduce our panelists later. For now, our speaker, Dr. Kelly Cormier, is the Food Safety Division Chief in the Center for Nutrition in USAID's Bureau for Resilience and Food Security. where she leads a team that addresses food safety risks and market constraints in food systems. She is a champion for gender and knowledge management within the broad, safe, and nutritious food system portfolio. She has been at USAID since 2008, where she previously, before her current position, worked in the Bureau of Food Security and as Division Chief of the Inclusive Market Development. Prior to joining USAID, she held an active research agenda exploring how the evolution of policies and institutions affect agricultural markets and the coping strategies of men and women. She has many different awards and distinctions, has been a Peace Corps volunteer, holds a PhD in development studies from the University of Wisconsin-Madison, and we are very happy to have you here. Over to you, Kelly.
Thank you, Lynette and Bonnie and Gain, for inviting me to kick off this pertinent and timely discussion about food safety and nutrition. USAID is very excited to partner with Gain to implement Eat Safe, which is a program designed to explore the risks and factors that affect consumers' perceptions about food safety. Eat Safe is launching in the midst of a global pandemic, which underscores the importance of safeguarding market access to safe and nutritious food. Amidst all this uncertainty, food safety has found itself at the center of a global discussion. While COVID-19 is not a foodborne disease, it is a zoonotic disease, likely originating from a fresh food market with inadequate food safety practices. In light of COVID-19, it is now impossible to ignore the relevance of food safety in achieving development outcomes across multiple sectors, including human health, food security, resilience, and of course, nutrition. Check with Lucien. Could my slide presentation be shared? Is that shared? Great, thank you. I'm pleased to see that food safety is receiving increasing attention among the development community, and I'd like to take a minute to reflect on how we arrived here today, discussing the current evidence and the knowledge gaps linking food safety and nutrition, which has led to the design and now implementation of programs like Eat Safe. This report, in 2015, the development community committed to end hunger, food security, and all forms of malnutrition by 2030. And as many of you know, last month, the FAO released the annual State of Food Security and Nutrition in the World report, which concluded that at this moment, we are not on track to meet this goal. This report emphasized the increasing need to provide safe and nutritious diets to feed the world's growing population. In fact, the SOPHI report estimates that 2 billion people in the world did not have regular access to safe, nutritious, and sufficient food in 2019. This statement from the SOPHI report highlights the fact that food safety and nutrition are inextricably linked within the food system. Nutritious, healthy diets are only possible when food is safe. Could we move to the next slide, please? Great, and the next slide. Thank you. Unsafe food creates a vicious cycle of disease and malnutrition, negatively affecting our most vulnerable populations, including infants, young children, elderly, and the sick. While we are still in the process of identifying gaps and generating evidence around food safety and nutrition, we know that we can't afford not to focus on food safety. We can't promote more nutritious diets if they're unsafe and harmful to consumers and beneficiaries. So I wanted to take a minute to reflect on what evidence exists that links nutrition and food safety before we delve into the research gaps that should be addressed in the future and which some of our panelists are working hard to fill. First, the WHO estimates that every year, 1 in 10 people worldwide become ill from consuming unsafe foods. The World Bank estimates that these foodborne illnesses cost low and middle income countries $110 billion in lost productivity and medical costs each year. Furthermore, unsafe food threatens one of our most vulnerable target populations, children under 5 years old. Consider that diarrheal diseases are the #1 cause of under 5 mortality, and up to 70% of diarrheal diseases are caused by unsafe food and water. Unsafe food not only undermines children's well-being, it threatens their lives. We also know that unsafe food causes 420,000 deaths per year, 125,000 of which are children under 5. So we know that safer food, it saves lives. USAID is continuing to expand our evidence base relating food safety hazards to nutrition outcomes. Preliminary findings, for example, from the Feed the Future's Nutrition Innovation Lab at Tufts University suggest that combined food safety hazards, including mycotoxins or microbial contamination of food and water, may contribute to poor nutritional outcomes. These findings highlight the need for more research to expand and deepen our evidence base on the relationship between food safety and nutrition. These consequences of poor food safety practices and their impact on nutrition outcomes cannot be ignored. Nutritious foods cannot be considered nutritious if they're not safe. The negative externalities of unsafe food make it impossible to achieve our nutrition targets, such as minimum acceptable diets. USAID's Bureau for Resilience and Food Security recognized the inherent interconnectedness between food safety and nutrition, and it placed our newly established Division for Food Safety within our new Center for Nutrition. The Division for Food Safety was established to address the heavy and undervalued health and economic consequences of poor food safety practices in developing countries. The agency and the Bureau understand that if we want to achieve sustained progress in nutrition, we need to utilize a systems approach. And you can see the slide now that refers to USAID's Bureau for Resilience and Food Security Food Systems Conceptual Framework. We know that that a systems approach must include robust investments in food safety throughout food systems. We recognize this global shift in dialogue towards a food systems approach was a vehicle for discussing the challenges and solutions for achieving resilience, food security, WASH, and nutrition in developing countries. And we wanted to position USAID to be a full and active participant in this global dialogue, and for USAID to have a shared language and understanding of how we work in resilience, food security, WASH, and nutrition as it relates to food systems and vice versa. So this conceptual framework that you see on the screen shows where we landed in terms of how these elements interact to support the work that we're doing. To meet this need, we collaborated with internal and external thought partners, and that led to this conceptual framework. It's easy to see and visualize how improved food safety can positively impact the primary outcomes of nutritious diets and health, as well as the secondary outcomes of income, health, and nutrition, ultimately preventing sickness and death from unsafe food. Food safety can be addressed along the investment levers to positively affect the outcomes of the food system. For example, Lucienne, can you go back to the previous slide, please? Thank you. For example, eliciting behavior change through food safety education can create consumer demand for safe foods to improve health and nutrition outcomes. And alternatively, investments in technology to rapidly assess contamination levels could help SMEs ensure quality and safety of their products. The ways in which food safety is integrated into the food system are endless. Through managing food safety risks within the food system, we know that we're able to better protect the health and nutritional status of the world's most vulnerable. We're excited to strengthen the evidence base, linking food safety to nutrition as well as other sectors in our new mandate as the Division for Food Safety. And I want to note that USAID has considered this linkage between food safety and nutrition for several years. One example of this is through investments in aflatoxin research carried out by the Nutrition Innovation Lab. This Innovation Lab's work on exploring the effects of aflatoxin on birth outcomes has broadened the discussion on the role of aflatoxin contamination in the food supply. Their observational studies in Uganda, Nepal, and Mozambique showed a significant association between aflatoxin levels in mother's blood during pregnancy and impaired birth outcomes. These poor birth outcomes included negative effects on head circumference and being born small for gestational age at birth in Uganda, where aflatoxin levels in maternal blood were extremely high. These studies revealed that maternal diet quality is not just about diet sufficiency and diversity. diet quality has a crucial food safety dimension that requires cleaning up the food system on which poor families rely for their daily consumption. This may be as critically important as improving access to safe water supply and improving knowledge and practices around water storage and usage. In our new mandate as the Division for Food Safety, we are eager to expand this research beyond aflatoxins to encompass a more holistic food safety approach. Last year, we awarded 3 new food safety mechanisms, each of which targets a different component of the food system to improve the safety of nutritious foods. The Feed the Future Innovation Lab for Food Safety, co-led by Purdue University and Cornell University, focuses on reducing the burden of foodborne disease from chemical and biological hazards. It leverages expertise in food safety, food production, nutrition, and international development, creating research opportunities for public-private partnerships to amplify USAID's investments throughout the global food system, particularly in value-added sectors. And the Feed the Future Business Drivers for Food Safety project works with micro, small, and medium-sized food enterprises to find market-driven solutions to food safety risks, particularly in informal markets, and help these businesses become agents of positive change in the effort to reduce malnutrition in these market settings. And finally, the Feed the Future Eat Safe project, which is the reason we're here today, it takes a consumer-centered approach to generate awareness and empower consumers in informal and formal markets to make informed decisions about the food they eat, thus creating demand for safe and nutritious food. All 3 of these activities are complementary and utilize a collaborative approach, driving towards a common goal of ensuring consumer access to affordable, safe, and nutritious food derived from local and regional food systems. To achieve meaningful gains in food safety and nutrition outcomes, this collaborative spirit must extend beyond USAID-funded programs to include other donors, implementing partners, and local government entities. The development community must work together as a unified voice, advocating for improved food safety practices while pursuing our overall nutrition objectives. I'm encouraged, for example, by the opportunity that the upcoming African Green Revolution Forum creates for building on strong African leadership to drive investment in diverse, healthy diets with the safety and quality every consumer needs. Policymakers and the private sector need strong evidence to motivate and inform investment decisions that address critical nutrition outcomes. And likewise, consumers and advocacy organizations need strong evidence to champion local food systems that deliver safe, nutritious diets. While we have made significant strides to elevate the importance of food safety in achieving our nutrition objectives, there are many opportunities for continued research and evidence generation. An overarching category of future research includes generating empirical evidence that strengthens the linkages between nutritional outcomes and safe and unsafe foods. We know that most nutrient-dense foods, including animal source foods, fruits, and vegetables, have the highest risk of contamination. Food that is safe for consumption maximizes nutrition outcomes for nutrient-dense diets. Further research should examine the linkages between food safety and nutrition based on the level of contamination. Low levels of contamination may manifest themselves on a subclinical level, not necessarily causing foodborne illness, yet still negatively affecting nutritional gains. This could occur by altering the gut microbiome and lead to environmental enteric enteropathy. Local governments should use this data to develop risk-based, evidence-driven approaches to identify the most pressing threats to food safety within their own food system. Other evidence gaps include the compounding effects of multiple contaminants within the same nutritious food item. For example, how might the presence of bacterial contaminants and antibiotic residues affect health and nutrition outcomes for vulnerable people? This is just one of the many possible scenarios that could be examined. Finally, we should explore research opportunities to establish a consumer-oriented approach and evidence base to improve food safety. Eat Safe is a part of that. This investment and this focus is supported by findings from the 2018 Global Food Safety Partnership Report on African Food Safety Capacity, which advocates to convene and collaborate with stakeholders to elevate consumer awareness of food safety problems and solutions, through education, the media, and other communication channels, and build national level capacity for consumer advocacy to improve food safety. So where do we take this? These are just a few examples of future research topics that could improve food safety and nutrition outcomes. I believe these evidence gaps serve as exciting opportunities to further strengthen the linkages between food safety and nutrition, and I'm eager to hear from the other panelists about where they believe the greatest evidence gaps lie linking food safety and nutrition. As we continue to fill these evidence gaps, we must remember that food safety begins at the farm and it ends at the fork. To address food safety issues holistically, the development community must employ an integrated food systems approach in collaboration with academic institutions and the private sector to support the most vulnerable populations, including women and children under 5. And I'm going to end now with the reminder that we cannot achieve our overarching goals of nutrition and food security without safe food. Thank you.
Thank you very much, Kelly. Wonderful presentation. We'll go straight into our panel discussion. We have 3 panelists. I will introduce them very quickly. Dr. Angela Perry Hansen is Senior Lecturer at the Department of Nutrition and Food Science at the University of Ghana. She has received several distinctions, awards, and fellowships over the course of her career. She works on research around several relevant topics, including, for example, aligning national food safety policies to enhance food security. She is a member of the National Codex Subcommittee on Food Hygiene and the National Committee for Microbial Specifications of Foods in Ghana. Welcome, Angela.
Thank you.
Dr. Sarab Mehta is a professor in the Division of Nutritional Sciences at Cornell University, where his research focuses on the interplay of nutrition and infection. He uses several different research topics to look at various aspects of this interaction, and currently has several large efficacy trials looking at the impact of delivering micronutrients through biofortified crops on nutrition and immune function in infants. He's worked in India, Sub-Saharan Africa, and Latin America. Welcome, Sarab. And finally, Dr. Saweda Liverpool-Tassi is Associate Professor in the Department of Agriculture, Food, and Resource Economics at Michigan State University. Her research focuses on emergent issues related to smallholder productivity and welfare within dynamic and transforming food systems. She has ongoing research projects focusing on changing consumer patterns, food safety along rapidly transforming food systems, and climate change in Sub-Saharan Africa. Welcome, all 3. I think we have approximately 35 minutes left for our webinar. Our goal is to have each of our 3 panelists speak for approximately 5 minutes on 3 topics related to the topic generally of food safety and nutrition, and then specifically to the presentation that Kelly has provided for us. They've been asked to speak on the following questions. How are food safety and nutrition linked, and which of these linkages are most important? What types of linkages and evidence related to those linkages are missing? How can stakeholders in nutrition, food safety, and the food system account for these linkages to maximize health improvements and avoid unintended adverse consequences related to food safety and/or nutrition? So I will pass the word in order, first to Angela, followed by Saweda, and finally Sarab. And please just go right ahead and start when the other has finished, and I will prompt you if there's any question going on. So over to you, Angela. And as I think was suggested in the chat, please do send any questions that you have through the Q&A button on the bottom of your Zoom screen. Thank you, and over to you, Angela.
Thank you. So I'll start with the most important links between food safety and nutrition and the evidence we have. The WHO Global Estimates of Foodborne Disease Burden has drawn much needed attention to the importance of food safety. Unfortunately, those reports did not have data on the burden of malnutrition due to foodborne diseases. There's, however, growing evidence that foodborne diseases, particularly diarrheal episodes and enteric infections, even when they are asymptomatic, can impede nutritional gains in low and middle income countries, which, by the way, has the highest burden of foodborne diseases. In many developing countries, nutritionists favor food-based approaches to improving nutritional outcomes. Fresh fruits and vegetables and animal source foods, excuse me, are among the most highly recommended foods for healthy diets. These foods are highly nutritious, but they are also the most vulnerable to microbiological and chemical contaminants. More so, most of these foods are sourced from informal channels where infrastructure, utility, and regulatory challenges hinder food efforts. Increased consumption of animal source foods may increase exposure to foodborne diseases. We know that farm animals are reservoirs of foodborne disease agents. For example, in a recent study, meat consumption during the Muslim Eid al-Adha festival resulted in 18% increase in diarrheal incidence among children in Africa and Asia. Apart from fruits and vegetables and animal source foods, staples such as maize and legumes such as peanuts are highly consumed in sub-Saharan Africa. These foods are commonly processed into complementary food blends, majority of which contain aflatoxins in excess of allowable limits. There's evidence of an inverse correlation between aflatoxin exposure and stunting. There's also evidence that aflatoxin exposure contributes to low birth weight in children in Africa. The mechanisms and causal relationships are, however, blurry. The most important link, in my opinion, is the research and developmental collaboration between nutrition, food systems, and food safety. This collaboration affords scope for safe production, processing, handling, preparation, and storage of nutrient-dense foods in a manner that ensures food security. This collaboration should extend to the cultural, economic, and regulatory factors that could act as facilitators or even barriers to value addition in food supply chains. The value addition increases or decreases nutrition and food safety risks. What evidence is missing? We all know that food safety and nutrition are compatible and need to be addressed holistically, but they have different characteristics. For example, in the way data is collected between the two disciplines. For that reason, they are conceptualized and prioritized differently and may even have different objectives. We need a multifaceted systems approach to value chain studies that understand the dynamics between food safety, food systems, and nutrition. We need that empirical evidence of the interactions between stakeholders through food systems and how these influence food safety and nutrition outcomes. Secondly, from the food safety perspective, Codex recommends the use of risk analysis framework to manage food safety risks. Few studies estimate the level of risk and fewer estimate the burden of foodborne diseases. National data coming from African countries are particularly scarce. There's limited capacity for risk assessments and lack of monitoring and reporting on food safety. In addition, national evidence on the burden of foodborne disease, cost of foodborne disease, and cost effectiveness of different options for reducing foodborne diseases are lacking. These are the data needed to justify prioritization and resource allocation to manage food safety issues and their corresponding nutritional outcomes. So what can stakeholders, how can stakeholders account for these links to maximize health improvements and avoid unintended consequences? Addressing nutrition and food safety issues require political prioritization and allocation of resources. Both of these are commensurate with the evidence of the scale of the issue and the need for governmental response at both national and international levels. So first of all, we need to generate evidence for prioritization. And we need to approach this in a collaborative and innovative way that addresses food safety and nutrition holistically and cost effectively, with co-benefits for each. These benefits should meet the diverse cultural and socioeconomic needs of stakeholders. We also need partnerships between public and private sectors and across academic disciplines, developmental agencies, funding institutions, and government agencies for the systems approach to integrated food safety and nutrition studies. For example, A value chain analysis in livestock in Nairobi, Kenya mapped structures that collated data on nutrition and food safety. This study then provided important information that supported policy development that co-targeted nutrition and food safety in an integrated way. We need a lot more such studies. With regards to food safety governance, Kelly has echoed a lot of my sentiments here. There have been discussions around co-regulation where stakeholders are empowered and incentivized to comply with food safety regulations, rather than a hard and costly approach of punishment for non-compliance. Empowering consumers to demand safer and more nutritious foods could incentivize food businesses to meet customer needs for business stability and competitive advantage. I'll end here and take your questions later. Thank you.
Okay, I think I will just continue from there. So I'll just say good morning, good afternoon, and good evening. And thanks to the organizers for inviting me to be part of this distinguished panel, and to all of you for taking the time to be here. So I'm coming at this conversation from the food systems perspective, where I'm thinking of or defining food systems as all the people and activities that are involved in the production, processing, distribution, and consumption of food. And so this clearly includes visible elements such as food supply chain actors, input suppliers, farmers, processors, traders, the food environment as well, including culture, socioeconomic characteristics, but also physical structures like supermarkets, wet or open markets where majority of the food in developing countries is purchased. And then I'm also talking about less visible elements. These include things like advertising and media, which influence consumer choices and preferences. So the food system really influences diets and nutrition through what it makes available, which we can think of as the supply side, but also how it influences what consumers want to buy, which is we can think of as the demand side. And so it's really important that when we're thinking about the link between food safety and nutrition, that we can see that the both sides of what food systems are influencing are really critical. So it's important for us to pay attention on how we can ensure that food supply chains and the food environment is supplying safe food. But on the other hand, we also need to pay attention on how we can actually increase the demand for safe food by consumers. And these are actually interconnected, as has been suggested, because if we actually have one way that we can increase the supply of safe food is if there's actually an increase in the demand for it. If consumers are demanding for it and in some cases may be willing to pay some sort of a premium for safe food, that can trigger a supply response in the food supply chain and in the food environment. In my work in looking at food systems, and particularly thinking about how food systems can be a mechanism for increased access or increased consumption of safe and nutritious foods, I think that there's a lot of evidence that has been generated over the last couple of years and maybe the last decade or so. I do think that there are some key gaps that remain. And I think that one of the gaps is an actual comprehensive understanding of the food supply chains in many developing countries, but also how many of these food supply chains have actually changed in the last couple of decades, often in response to changing consumption patterns because of things like urbanization and increased incomes. And I think that this is really critical when we are designing interventions to increase the consumption of safe and nutritious foods. So I'll be talking about some examples from ongoing work or work that we have done on the maize and poultry value chain in Nigeria. So we have these food supply agents or economic agents that are engaged in the production and distribution of maize and maize-based products. And as we have heard, there are a lot of efforts to reduce challenges with maize in terms of aflatoxin. So if you think about it and you have all these economic agents all the way from the input suppliers to the maize farmer, the traders, processors that are purchasing from him, and then the retailers and the consumers, these are all economic agents that have a role to play in increasing the supply of safe food. However, before they can do that, there needs to be one, information or knowledge about what they actually need to do, practices they need to adopt, or technologies that can increase their availability or ability to supply safe foods. But there also need to be incentives for them to do this, right? So if you take a maize farmer who's being encouraged to adopt a technology or practice that is going to enable him to have maize at harvest that has low levels of aflatoxins, for example, there needs to be an incentive for him to do that. one hand, it could be through the market, right? So if he knows that the processor, the trader, or the consumer who's going to purchase his maize is willing to pay for the product, and that payment is it's able to cover the cost of his investment in that technology, he might be more willing to adopt it. But there are also other mechanisms through the policy environment. If there are policies or regulatory frameworks which either reward him for supplying safe products to the market or which penalize for the provision of unsafe products. But if there's no regulatory framework or incentive, then the provision might be less of a priority. And these are really critical when we're thinking about food supply chains, because each of these economic agents along the food supply chain is facing a slightly different market environment and possibly relevant policy levers or initiatives necessary to incentivize or guarantee that the product will be, a safe product will be supplied to the market. In our work on the aflatoxin along the maize value chain, we actually found out that there's a need for a much more comprehensive view of interventions for achieving food safety. So let's think about the issue of aflatoxin again. A lot of effort has been played to increase the farmer's ability to produce a safe product. However, we have to recognize that all along the value chain, there are numerous actors that will also handle that maize before it gets to the final consumer, which could be a household or a processor or a feed miller. And all along this chain, there are opportunities for providing safe product, but also for contamination. We found out in our study that samples that were collected from farmers at harvest often had relatively acceptable levels of aflatoxin. But after they had been stored for 3 to 4 months, the levels of aflatoxins had increased significantly and were often at levels that are not safe for human or animal consumption. We also found out that there are numerous opportunities because you have the maize traders, retailers, processors who might also be storing the maize and might not be adopting safe practices, such that even if you have a safe product at production, you might not necessarily have a safe product at the consumer level because of the contamination that could have happened along the chain. We also found out that even for people that are making maize-based products where you are mixing ingredients, for example, feed millers, the maize that they were using had relatively acceptable levels of aflatoxin. By the time they were mixed with other ingredients like groundnut or peanut cake, the feed itself had extremely high levels of aflatoxin because of that mixture of the ingredients. So when we're thinking about interventions, it's really important that we recognize the complex nature of the food supply chain, the numerous actors facing different policy or market incentives, so that we can develop incentives or interventions that will be able to preserve the quality of the food along the supply chain. And it's important for us to recognize that we cannot only focus on one node without taking into account the agents or actors that will also be dealing with the product. And then going to this issue of how is evidence being generated and who's generating? I think that I've been fortunate to be part of 2 approaches. One approach is what I think is actually quite traditional, where many of us are operating in our disciplinary silos. We're doing really good work and we're circulating it within those silos. But actually, I've also been part of what I would call a multidisciplinary team. And I think this is really critical when we're thinking about issues of food safety, because we need the pathologists, the toxicologists that understand these contaminants in our food to be part of the research project or the research endeavor or the evidence generation process. We also need the food technologists. They're doing a lot of amazing work developing practices, technologies that can actually be used to reduce the level of these contaminants. But why would a processor adopt a technology when there's no potential market benefit? And so we do need the economists and the others who have an insight or can study the market environment, the policy framework relevant to each economic agent with the broader system in perspective to be able to develop appropriate interventions. And then I think in terms of how do we get all these stakeholders integrated on dealing with food safety, I really think there needs to be much more conversations about the complexity of the actors that are engaged in providing safe food, how they interact, and these voices need to be part of the conversation during the process of design of interventions, but also during the process of implementation. There are a lot of nice sounding policies and strategies that have been developed over the last couple of years, but we really need to have a coordinated effort involving private sector, civil society, market association, traditional rulers, if we're going to develop a system that actually supplies or incentivizes the supply of safe food, as well as increases the demand for safe food. Because consumers can only demand for safe food when they are confident that actually an environment that allows them to have access to that safe food exists. Thank you.
Hi, everyone. Again, thank you for this opportunity to contribute to Eat Safe. It's, I think, a much needed effort in these times. As part of this effort, we are currently working on synthesizing evidence on links between nutrition and food safety from a nutrition perspective, and across the value chain with particular focus on short and long-term physiological, health, and economic impacts of unsafe food, as well as identifying evidence gaps and potential intervention or disruption points, and with potential recommendations for research and policy. I feel like the advantage of coming last is that a lot of stuff that I wanted to say has already been said, and in a much more articulate fashion than I will probably, I won't probably be as eloquent as some of the speakers before me. But just to highlight some of the pieces and second some of the things that people have already said, from my perspective, at least from what we have looked at so far, examining the links between food safety and nutrition, one of the key research gaps that's missing, even though it might be very obvious that unsafe food might cause diarrhea, unsafe food might cause these things, the most direct link so far that we have linking a specific toxin or specific food safety hazard with a specific nutritional health outcome is between aflatoxin exposure and some of the health outcomes that have been linked that Dr. Cormier already alluded to. For hazards that cause gastrointestinal disease, for example, oftentimes the disease attributable hazard or the risk in food safety is not reported or identified because there is lack of testing, and also because outbreaks are not recorded systematically. So from my perspective, I think one of the biggest things that we need is harmonizing research protocols across disciplines, which includes detection methods, study populations, and also across implementation partners. The second key piece, I think, from my take home at least, is that make determination of key indicators of nutrition, food safety, and infections inexpensive, rapid, and decentralized. So that is something I think that's critical for this food systems approach to really take shape and be effective. And this might include legislation, education of all stakeholders, which might be informed by evidence, and then motivation, like people, one of my co-panelists already talked about, incentivizing producers and vendors to adhere to food safety measures, education around proper storage, transport, preparation, and then also technology development of affordable and field-friendly methods for assessing food safety and their impact on nutrition. Those are the things I think are really needed and key for us to achieve this vision of Eat Safe. I'll stop there.
Thank you, all three panelists. Those were really fantastic and so much, such a rich discussion already. I would like to kick off the question and answer. We have many, many questions already in the chat box, but I would like to kick off. Perhaps I'll start with you, Sueda. Can you speak to the question of how we can help empower consumers of all backgrounds to demand more safe and nutritious foods?
So thank you very much. So can you just take that again real quick?
Yes. How can we help empower consumers of all backgrounds to demand more safe and nutritious foods?
Okay. Like I mentioned in my presentation, I think that consumer information is really powerful. So in some of the work that we've done in Nigeria, we looked at different methods for, again, it was focused on aflatoxin, and we looked at different methods for reducing the level of aflatoxin contamination through some kinds of processing measures. So for example, we use of lactic acid bacteria fermentation. And what we found out was that at the end of the day, we were able to take the results from our studies and translate them into formats that are actually more readily available or acceptable to consumers and processors. So we developed non-technical, policy, non-technical communication pieces, videos, and then we went to rural communities. So we said, yes, we are going to be working at the policy space, but in addition to working to the policy space, let's take the information to the consumers about how they can potentially reduce the level of contamination, how they can identify identify products that might have a higher probability of being infected, since aflatoxin is not something that you can detect with the visible eyes. But we were able to provide them with information and see kind of how they responded to that. We also did actually a choice experiment in Nigeria where we were able to find out that if you provided information to consumers about the negative health impacts of aflatoxin contaminated food, they were actually willing to pay a premium for a product that was we created actually in our experiment, a real product, and they were willing to pay for that product. But the challenge remains that if you provide them with information, but there's no confidence in the regulatory system, then that also is a challenge. Because a consumer can be demanding for safe food, but if you have an issue like aflatoxin that it cannot be detected, then they do need some way for the product to be certified or to be able to signal to them that this is a safe product. And I think that's where the challenge lies. I think that we can do a lot with information. I think there are studies that have shown that information can play a role in changing or incentivizing or changing or altering behavior. But I think we do need to also pay attention to the fact that if you provide information and people begin to demand the product, is that product actually available in the market? Thank you.
Thank you. Angela, how can we guide policymakers and private sector stakeholders to include food safety in their food systems policies?
Thank you for that question. With regards to policymakers, I think, and stakeholders, we need to address it collectively. There has to be a participatory approach between them and the researchers to look at the evidence that's available and sort of develop a roadmap on how food safety can be improved in the short term, in the medium term, and in the long term. So if I can use Ghana as an example, we realize that, as you'd see elsewhere, our informal food channels present a lot of food safety risks. So the Ghana Food and Drugs Authority decided to remove some of the barriers to food registration and licensing by small and cottage food industries. And they launched a progressive licensing scheme that is a 3-tier approach where market actors or food processors could gradually and progressively implement systems that will reduce food safety hazards within their operations and their foods. And at the same time, it offers them reduced cost of licensing, access to advice from from the policy angle, and they also get to access formal markets. So some of the issues that Sawida mentioned, for example, how do empowered consumers know whether the products they are buying has acceptable levels of aflatoxins? Even if they have, let's say, a cereal product that can be processed in a way to at least minimize the concentrations of aflatoxins, and these products can be registered and still be available within the formal channels, then consumers buying them will know that once it has the FDA registration, the product is safe for consumption. But in addition to that, we need more long-term approaches to minimizing food safety risks along the entire value chain. Thank you.
Thank you. We're going to come back to that in a moment because there's several questions related to different aspects of the value chain, but I do want to direct one question to Sarab before we move on. Sarab, what is the scientific evidence telling us about consumers, food safety, and nutrition? How can we use this intervention, or this information, to mitigate the secondary effects of COVID-19 on nutrition?
Thank you. I think, means we all know, and I think the Standing Together for Nutrition team did a fantastic job in the Lancet last week, summarizing the unprecedented impact of this ongoing pandemic, that is the impact on nutrition that we expect and on some of the health outcomes, particularly in key vulnerable populations. So I don't think the guiding principles are things that, to ensure food safety and ensure understanding the linkages between food safety and nutrition, I don't think those guiding principles change. I think we need active surveillance systems, active food surveillance systems, and we need the same kind of structure around incentivizing for producers and vendors to make sure that the food is safe. We need the education efforts to make sure that people are aware of what the food safety challenges might be, and they're only going to get magnified during this time. And so it basically, I think, in my opinion, it comes down to implementation of proper food safety surveillance systems, because we are going to see decreased availability, affordability of foods. There's going to be disrupted supply chains and so on. So all of those things are even, I know a lot of efforts are underway to estimate the impact of that. But I think it's even, I think even some of the best efforts might be conservative in the impact that this pandemic might have on food safety and nutrition.
Thank you. If others aren't familiar with the Standing Together for Nutrition initiative, there were 2 recent publications in The Lancet, and I'm sure we can send around the references when we send the link to the recording of this session. Kelly, one quick question for you, if you can answer quickly, please, related to USAID. Are there considerations within the RFS systems conceptual framework to incorporate approaches that foster both market and food environments that improve economic and nutrition outcomes for households?
The short answer is yes. Yes, there are, and in fact, this conceptual framework was finalized just this spring, and there are really exciting opportunities and conversations that it's already fostered across technical sectors. So yes, I think we're hoping that this framework will help us to pull together resources and investments, define roles across stakeholder groups so that we can work together better to achieve those primary outcomes that I talked about, including healthy diets. Thank you.
Thanks. We have a couple of general questions related to what actually falls under the scope of food safety. Are food additives and preservatives under that umbrella? And if so, could there be effects of food preservatives and additives in the development of chronic illness? Can I pass that to one of you for a quick answer? Whoever would like to take that.
If I may, food
Yes,
additives. Yes, so food additives and preservatives does fall under the umbrella of food safety. Codex has recommended maximum limits for additives that are allowed in food, and adding them in excess of the recommended concentrations could pose a food safety risk. Chemical hazards are very difficult to monitor, but we know that the effects of chemical contamination are long-term, right? So we may not see the effects immediately, but then they accumulate in the body, and when we are old and you want to enjoy your retirement, that's when a lot of these chronic diseases kick in. So yes, additives, chemical preservatives do fall under the food safety umbrella and could pose chemical hazards or chemical risks if they are present in excess of allowable concentrations in food.
Thanks. We have several questions related to the specific actions that can be taken, for example, with mitigating the food safety risks of fruits and vegetables. There was one question about fish. There's several others related to different food commodities. And I think and some of these questions asking, how do you manage that at the farmer level? How do you manage and minimize those risks at the farmer level? And then others at the market level. So I wonder if I can pass it perhaps first to Saweda, and then anybody else can come in afterwards, just to maybe provide us with a couple of references to resources. So that's a long answer to a lot of different questions there, but perhaps you can just point our listeners to a couple of resources where they can find information about some of these questions related to minimizing food safety at farm level, thinking about fruits and vegetables specifically, thinking about commodities such as fish specifically. And then we also had one question related to food service industry and the risks related to poor refrigeration within the food service industry. So over to you, Saweda, and then anyone else, feel free to come in quickly after.
Yeah, so I think that these are really, really important questions. And I think these are exactly the kinds of issues that we need kind of a collaborative approach to dealing with, right? So we need specialists. So for example, when you're talking about specific commodities like fish or poultry, you have antimicrobial resistance, you have all these really food-borne disease-related issues that are specific to commodities. And so I might need some time to be able to get some material on the ones that I know. I can't think of exact ones for all those questions right now. I could speak for those on aflatoxins, but for the other ones that you mentioned, I would need to go back a little bit to have some time to reflect on that. And so I think that what has been raised is the fact that we really need a lot of coordination in terms of the proposed recommendations. I saw a question even talking about farmers, right? Even for how farmers deal with aflatoxin, right? So there's a lot of work that has been done on things like biocontrol, but then also talking about their storage practices. When you have a lot of smallholder farmers who are just drying their maize, how do you ensure that they're able to keep their maize safe even during the storage on their farm? Talk less of when you get to traders. We did a survey in among several maize wholesalers in Nigeria, and across multiple markets, we found that very few of them had actually been trained on maize handling practices. Less than 10% of them knew about aflatoxins and how to deal with it. So we need to have really this coordinated effort where there are practical solutions coming from experts on how to deal with these foodborne diseases or pathogens at each node. So what should a farmer do? What should a trader do to preserve it? What should a processor do? I think we need all these kinds of information and having conversations that bring these to light to be able to achieve this.
Thank you. Given time, I think we'll leave it there. I would like to give the final thought back to Kelly for a few reflections. Over to you, Kelly.
Thank you, Lynette, and to all the panelists. This was a really dynamic discussion. I know I learned a lot, and what I'm particularly excited about is that this is the beginning of a series. It's not the beginning of the discussion because clearly there have been, we didn't get to this point without a lot of strong voices and some really important evidence that motivated some renewed interest and highlighted some opportunities. So I just wanted to note that. A couple of key takeaways I wanted to highlight. Angela made the point that when she reflects on the linkages between food systems, food safety, and nutrition, I like the way she put this. She sees this as affording great scope for collaboration among safe production, processing, and storage. So I really like that these linkages translate into collaboration. I think that's a really good way to think about it. And then Saweda offered some really important thoughts. Thinking about systems is complex, but I feel like Saweda's presentation really helped us understand what some important entry points were. In particular, I wanted to highlight her focus on both paying attention to the supply and the demand. How are food systems supplying safe food, and how are they influencing demand for safe food? So I thought that was something that I wanted us to think more about. And Saurabh outlined in his remarks some really important recommendations for how to improve research protocols. You know, how do we continue to work together, supporting research practitioners in institutions to work across sectors and inform policy changes. So I think I'll end there. Thank you so much. Really, really great conversation.
Thank you, Kelly, and thank you, everyone. Really fantastic questions, and I know I didn't do justice to highlighting all of the important questions that were showing up in the Q&A. But I do hope you will join us again on the 19th of August at 8:30 Eastern Time. That's 2:30 in Geneva, 3:30 in Nairobi, lots of other time zones. Our topic on that session will be food safety in traditional markets in Africa and Asia. And we really hope you'll join us then again. And we're very grateful for all of you joining us here today. And we hope you enjoyed it, and we hope you learned something. We look forward to hearing and seeing you again. Goodbye, everyone.